I want to welcome you. Are
Hi,
you there?
thank you. Thanks. Glad to be here.
Great. We've been talking about telemed just a little bit, some of the advantages and disadvantages and technology glips and things like that as we've waited for you. But now that you're here, we can kind of officially start. And I'll let you all know that Dr. Debbie Boland is in Florida. She can tell us a little bit more about her practice there, but she's a movement disorder specialist that's worked with us for a few years now. And what she's going to do today is she's going to spend the first portion of this meeting talking about telemed, because they're just within the past couple of days, Medicare has made some really significant changes that are going to be beneficial for all of us, I think. And then after that, after we complete the conversation about telemed, Dr. Boland's going to talk a little bit about surviving during a pandemic. And what we're going to focus on during that conversation is we're not going to talk about the statistics and the data and the numbers and, you know, all of that kind of fact information you can get from any news source. What Dr. Boland's going to want to talk about is how day to day, how you're doing things that can be helpful to you, sharing that information with each other. We're going to talk about kind of quality of life despite, you know, having to be in our homes and be separated.
Thank you for that introduction, Judy. That was phenomenal. So thank you so much. I appreciate it. How is everyone today? I hope they're doing well and surviving in all of this interesting times that we're all going through. So everyone wants to know a little bit about the doctor. So I always try to start with that a little bit. If you haven't heard me, I've been on Lunch with Docs before, so thank you for hosting me again. So I am a movement disorder specialist. I did my movement disorder fellowship at Duke University. And then I did my neurology residency. So I'm a board certified neurologist at University of Illinois. And I went to medical school at Des Moines University. I'm a unique movement disorder specialist in the sense that I practiced as a physical therapist and worked with a lot of Parkinson's patients in the physical therapy realm prior to going to medical school. And I specifically went to medical school to do neurology and likely movement disorder specialist. So that's a little bit about me. In 2017, I saw that there was a huge unmet need within our community for chronic illnesses and chronic issues related to neurology discipline. And, you know, things have turned upside down in the past few weeks in healthcare, but, you know, it was an ever-changing, dynamic, rapidly changing environment. And so I made some very tough professional decisions and decided in 2017 to open my own practice. And I wanted to create a unique niche within the market that nobody else was really doing. So my practice is modeled after the direct pay care model, and some people abbreviate that for DPC. And what that is people pay a monthly membership, and they are able to see me in person if they're local, and in their home environment. I have an office that's for admin purposes only, but I don't see any of my patients in my office. I come to them. And, you know, that solved a big problem because many of my Parkinson's patients, as they advanced, really struggled. Even if it wasn't getting there, it was sitting there for so long and having to wait and go through the whole entire process and so many steps in the process. And why was that necessary to see their physician? So I started going to see patients in their homes. And then as part of that, immediately in 2017, we developed this program where people could have telemedicine services in whatever format they wanted. So telemedicine is kind of a big umbrella. And, you know, right now, again, it's rapidly changing. So there's many different definitions out there. But from my perspective and my viewpoint, telemedicine is a big umbrella up here. And under that is, I view it as any interaction you have with your physician that is not face-to-face live in the same room. So that telemedicine could be delivered via video, that telemedicine could be delivered via a telephone, that telemedicine could be delivered via text message, that telemedicine could be delivered via email. So all of these different ways are ways that you're communicating and interacting with your physician to get the care and the help that you need. So when I viewed it from that perspective and believed that the best success for my Parkinson's patients and my other neurologic patients was frequent, constant interaction with their doctor, then I developed a model of care within my practice, not a global model of care or a national model of care, but a care within my practice to address that need. So patients who are members of my practice receive unlimited televisits in whatever format that is. So they can text message me unlimited, they can email me unlimited, and then they can set up telephone calls or video visits anytime that they so choose to schedule that visit with me, and there's no limitation for that. And then we put a limit on how many times they go out to their house in person. Or there are some of my patients who do just the telemedicine only option. So my local patients, many of them want to be seen in person, but I have patients who are not local who want to just then receive the telemedicine piece. So then we do all of those things that I've discussed. Again, they're via video, via telephone call, via text messaging, via email. And so all of those ways we communicate with them. So, they've done studies, and the studies have come out, and they've come out in neurology, but I think they're going to come out much faster now with the new federal laws. There were so many federal laws, and I don't want to get into the nitty-gritty of it, but there were federal laws to accept insurance reimbursement, especially federal reimbursement, on how we could see a patient by telemedicine. And that new Trump order that came out on, I believe it was Friday the 13th, I was headed to Canada with my children, but instead of us going to the airport, we were sitting watching Trump. And when he made the big announcement about all of the telemedicine stuff. So previously we had many, many restrictions that limited what physicians could do. We knew we needed to do it, but we couldn't do it if we wanted to get federal monies. So in 2017, that's why I set up my practice as the DPC model, the direct pay care model, where I don't accept any reimbursement from the federal governments and the federal government's insurances. And I just have patients pay me directly. And they're very thankful and appreciative for those services. And the cost for those services and the benefit for them really is greater than what the cost is. And so now the federal government has relinquished some of those restrictions on delivering care in non-face-to-face ways, but there are still many challenges in place logistically to get all of that taken care of. But for me, because I'm not seeking to get reimbursement from the federal monies, I don't have any of those restrictions in place. So it's been a very easy situation for me these past few days from that perspective. It's been kind of business as usual, except juggling all of the other interesting things within a working community, such as my schools are closed for my children. And how do we manage that? But, for me, it's business as usual. We're seeing patients via telemedicine, as we previously had done. There were studies done in Parkinson's disease at University of Rochester, I believe in New York, where they took patients that were seen via video by a movement disorder neurologist, and then patients who were seen via in person, and the outcomes and their quality of life measures were the same. That study is a phenomenally powerful study because it shows that we can do what we need to do as a movement disorder neurologist with Parkinson's patients by video. And that you will have the same quality of life, you will have the same outcomes as someone who goes through all of the trouble and all of the cumbersomeness of getting to a movement disorder neurologist. So I think you know, obviously I probably have a biased opinion as a movement disorder neurologist, but I think for patients, if your choice was to see a primary care doctor or a general neurologist face to face, or a movement disorder neurologist via tele, I would absolutely choose the movement disorder neurologist via tele. So, you know, I think people are becoming more aware in these times that these are options and they're efficacious options. We recently had a migraine study that came out and a headache study, same data. The patients who were seen in the clinic at the university setting, and I don't remember the university off the top of my head that did it, but that study showed that the patients who were seen via video had just as good of outcomes with their headache management as patients who were seen in the clinic. So neurology is a unique profession in the fact that we are one of those professions that it can be very efficacious to see patients via video, because we don't have some of the basic challenges of, if I was a heart doctor and I needed to listen to your lung sounds, that would be a little bit more challenging. But as a movement disorder neurologist, I can sit here on the computer and do this, do this, do this. Move your computer back a little bit, stand up and walk for me, right? So I can observe all of those kind of motions. I can have somebody using an iPhone who's doing video, and we can see what their tremor looks like in the arms outstretched in this position, or just in a resting position. So there's a lot of things that I can see on a physical examination by video that really make and drive my clinical decisions as a physician. And so I'm able to provide this service very effectively and thoroughly.
Great. Okay. Did you have anything else you wanted to share specifically about telehealth with us, Dr. Boland?
No, and we can kind of talk a little bit about how do Parkinson's patients do in the form of, you know, during this challenging times, and then we can kind of open it up for discussion if you want.
Okay, if you don't mind, I would like to share something with everyone about telemed in general, because although, of course, we're focused on telemed for people with Parkinson's, the services are available more broadly than simply telemed for Parkinson's. So for those of you who may not have a movement disorder diagnosis, but you know, are isolating, self-isolating, this may apply to you as well. What I'm going to do, I hope, let me get back to where I am. Okay, there I am. I'm going to share my screen so you can see where I'm getting this information from. Let's see if I do that. Here it is. Can you see that? Are you able to see cms.gov, which is Center for Medicare Medicaid Services? And then what I'm showing you is a Medicare telemedicine healthcare provider fact sheet. And this is from the 17th. And
yep.
It's specifically from the people who are going to be handling these changes to telemed. So if you want, you can, of course, you know, pull it up yourself and get it later to read the whole thing. But there are a few things, fortunately, at the end of each of these sections, whoever made this thought to give us some key takeaway points. And I wanted to just share the ones applicable, you know, and relevant to kind of the patient's perspective. The telemedicine visits are considered the same as in-person visits and are paid at the same rate as regular in-person visits. So if you do have Medicare, Medicare will pay at the same rate as it has been paying in the past for going to see your doctor in person. And however, look down here, Medicare coinsurance and deductible will generally apply. However, the Health and Human Services Office of Inspector is providing flexibility for healthcare providers to reduce or waive cost sharing for telehealth visits. They want doctors and people to see doctors right now, one way or another, in order to, you know, to cope with the challenges of the coronavirus. virtual check-in services. These are where your doctor may call you and say, hey, how's it going? You know, we talked, have you done what we talked about? They can only be reported if you're in an established relationship with your doctor. So you can't just, you know, a doctor can't just call you and drop in and ask you these questions. It's with your doctor. And in the past, Medicare limited telemed to rural settings. I know, like in Arizona, you know, it was only in places where there weren't population centers. People were pretty far from being able to see certainly movement disorder specialists, but doctors of any kind. So Medicare has decided that's no longer an issue. I know at PMD Alliance, we're really glad to see that, because, you know, it's not always a matter of distance that you can't get in to seeing your doctor. Sometimes it's just too much of an ordeal, and it's to be able to do telemed at home would be such a benefit. And then I'm going to go on down, and of course, first of all, again, your doctor has to have an established relationship with you in order to bill for the services. Let's see. Again, not rural. Patients with their doc can go without going to the office, and you need to initiate these services. So your doctor can tell you about what's available, but you need to opt in with your own doctor in order to do that. Nothing, you know, too serious. You just say, hey, you know, I like what you're doing with telemed, to Dr. Boland or anybody, and you know, you say, yeah, let's do that. Let's try that. And then your doctor can proceed to make you an appointment to work within their technology and their systems. So I hope that's helpful to you. Again, as I go up to the, where am I? Let's see if it'll go. You know, go all the way up. The cms.gov is where you find things about Medicare and Medicaid, the official government story. And then this is, then if you go there, you can look for Medicare telemedicine healthcare provider fact sheet if you want to make sure that what you're thinking about is in line with how, if you have Medicare, with what Medicare allows, and then also be able to perhaps, you know, have a more informed discussion with your doctor. So that's all I wanted. I'm going to stop sharing and turn it over to you, Dr. Boland, to talk about day-to-day living despite the coronavirus, despite being at home and this whole pandemic. We're not going to talk about numbers and facts and data. That's not, I think, what really is impacting all of us the most now. What's impacting us the most now is just being at home, not being able to go to the store, taking care of each other. Maybe one of us is tested positive now, you know, all these different things that add stress and more stress. And then on top of that stress, I think there's another kind of stress that can sometimes happen, which is we begin to feel isolated and bored. So I'll turn it over to you, Dr. Boland. Tell us what to do.
Oh, only if I had the magic pill.
Yeah. Right.
Oh, goodness. Well, I think it's a multifaceted, multi-layered problem, right? Mm-hmm. So there's many components to this issue. So where should I start? Where should I end? Who really knows? And by no means where I start do I feel is the most vitally important issue, and where I end is less important or more important. It's just all information we need. So I would start with the basics of schedule. So if you were somebody who got up in the morning, had your breakfast, went out to Rock Steady Boxing, then after Rock Steady Boxing had coffee with your friends, then came home, made yourself some lunch, went out for a walk in the afternoon, visited with the neighbors in your neighborhood, and then perhaps, you know, had dinner with your family, or perhaps went out to dinner a few nights per week, that was a schedule, right? And you had a schedule and you had a set way of doing things. And what I find is most of my Parkinson's patients tend to be regimented people. They tend not to be the haphazard people. They tend to follow a schedule. So I think reestablishing, making a new schedule of your day-to-day routine is vitally important. And I chuckle because literally right before I got on the computer, I was ensuring and going over with my care providers for my children what their schedule was for the afternoon. And because this is all new to them, because they're having to see my kids more. And, you know, I just sat there and thought, and I'm like, every one of my Parkinson's patients, or I see a lot of dementia as well, my dementia patients needs to revamp their schedule. And everybody needs to look at their schedule. And I think in times like this, it's important to write it out even, right? Because you can easily fall off a schedule when you're in one location and you don't have to move from one location to the next. So, you know, whatever it might be, 7 o'clock, I'm going to get up, you know, 7:30, I'm going to have my breakfast, you know, I'm going to find an online rock steady boxing class and I'm going to do that at 10 a.m. You know, I'm going to find a social connection that, you know, perhaps PMD is starting to set up, you know, online at such and such a time. I'm going to have my lunch at such and such a time. So I think that's vitally important, number one. Number two, I want you to stay physically active. And I want you to try to get back to the routine that you were in previously. If you were, you know, we know the number one thing for neuroprotection and helping our nervous system when it comes to Parkinson's disease is exercise. So in these times, I want everyone to be exercising. I want them to be releasing as much dopamine as possible. I want them to be releasing BDNF, right? That's that brain-derived neurotrophic growth factor in their nervous systems that we know that helps with neuroplasticity and thus helps to prevent neurodegeneration at the molecular cellular level, thus at the synapse level with Parkinson's disease. So I want you to be exercising the same quantity, same intensity you were doing previously and attempting to do the same kind of format. So if you were somebody who did independent exercise, well, you just simply continue with that. If it was walking, biking, you know, if you were swimming and have a pool at home, continue to swim in your pool. If you were someone who did group exercise classes, I know they are popping up everywhere online right now in these times. So find a group online exercise class that you can connect with. If you used a personal trainer, I bet your personal trainer would figure out a way to do that via online with you, right? So connecting and doing that is very, very important. Making sure that we're not stress eating, right? And we're maintaining that healthy, well-balanced diet and making sure that we're getting the adequate fluids in that we need every day, you know? And I tell people, I don't make any judgment about caffeine and alcohol as long as it's in moderation, but it doesn't count towards your fluid count, right? And in stressful times, people tend to drink more caffeine, more alcohol. So again, we need to be careful in those areas. And so to ensure we're maintaining our health. Ensuring, you know, back to those social connections a little bit, ensuring that we're maintaining those relationships that we previously had, even though if those are FaceTime, even if those are Zoom, however those might be, to the point of if you had a cup of coffee with 5 ladies after your Rock Steady boxing class, well, you all 5 ladies are going to do it on Zoom now or FaceTime or Skype or whatever it might be, and you're going to sit there and drink your cup of coffee at home and have the same kind of chat and interaction that you previously had. You know, you're going to maintain those social family connections. If you love to see your grandkids and your grandkids came over every Saturday, well, you still keep the same routine. You see your grandkids on Saturday, but you see them by video. And you have that same fun talk that you would always have with them in those same kind of interactions, although they're not live and in person, they're live by a video. And yeah, there's definitely that human touch piece that's lost that we all know is so important. And for that, this too will pass, right? Let's just keep remembering that. This too will pass, and we'll be back to that human touch component with all of the other components. But I can't think of many things that we would have to compromise in today's world of technology beyond human touch, and that we couldn't figure out an alternative and compromise to right now. You know, so making sure we're having all of those connections. And if you're an older person who didn't have the technology in place, that's when you've got to reach out to your family and to your community and say, I need this technology, please help me. and then have people help you get that technology in place so you can stay connected to friends, so you can stay connected to family, so you can stay connected to your medical world, you know, and then remembering you don't, your medications, that, you know, you're refilling those and you're getting those, you know, some people are switching to delivery, you know, with their local pharmacy, you know, making sure that you're online, if you're getting online, you know, 90-day mail away, that those are staying up to date and you're not running out of medicine, those kinds of things. And then making good choices as to how often and frequently you should go out. And, you know, social distancing, I was talking to Serena Fazan yesterday with a Facebook Live interview, and she's a local well-known reporter here in the Tampa Bay area, and she recently has left the TV world and is doing her own different news reporting primarily through social media. So she and I had a live Facebook interview yesterday, and, you know, she was like, you know, are we supposed to hug our children now? She's like, I have a 12-year-old daughter. What am I supposed to do? And for that piece of advice, I don't think we have to be 100% isolated. You know, we're saying groups of 10 or less. So I think my Parkinson's patients, my neurologic patients, I want them to make good, wise decisions with that. You know, we say 6 feet apart. So if someone could come to your home, you don't touch them, you stay a little distance apart. If someone's been sick, by all means, they shouldn't be even coming into your home, you know? But if somebody's healthy and well and one person wants to come visit, that's a personal choice and decision I think each person needs to make for themselves, understanding risks and benefits, you know? And then trying to avoid those high-risk situations, right? You don't want to be in groups of 10 or more, going out to the grocery store as little as possible. My local grocery stores have set up specific times for seniors to go in the morning, and seniors are only allowed to go to Publix during those times. And I think that's a phenomenal idea, and I love it. So I think there's lots of different choices there. You know, some of our people have converted to all online delivery for their groceries and all of those kinds of things. So there's many different options how to keep your social distance. But I think too, it doesn't have to be 100% removed. And in that situation, you use risk versus benefit and make really good choices. And every single person is going to be individual of what their risk and benefit is and what they're comfortable with at this point in time. And I think we all need to be accepting of each other and not pass judgment if one person is choosing. As long as we're working within our guidelines, I think we need to all make good, wise choices, but different people are going to make different individual choices as to what they're comfortable with and what social distancing means to them.
Okay. Well, that is all good advice, Dr. Boland. And what I want to do is does anybody want to ask Dr. Boland questions about either of our topics or share something that you think we all would want to know? You know, you can mute or unmute yourself, of course. And, you know, we can have that conversation as well.
I have a question.
Yes.
For the doctor, when you do the online visits, do you record them?
No. No, we do not record.
Okay.
Can I ask a question?
Yes.
Of course.
Hi, I'm sorry. I'm doing this very, it's a very rare thing. My father's in Minnesota. I'm in California. I'm on my bedroom floor with Google Home video device trying to have him listen to this meeting. My father has Parkinson's and he now has 3 caregivers in his retirement facility. And I feel very isolated and very concerned for him with trying to keep him safe with having a compromised immune system. And I'm trying to figure out the best way to communicate to his caregivers because I know that they're probably going to the grocery store. They're probably out there getting exposed. And I think my father's level of concern might not be at where mine is. So I'm just really trying to figure out how I can protect him besides asking them to wash their hands, how I can really make him become an advocate for himself.
Ugh, that's the $1 million question, right? So I think, I mean, obviously, you know, trying to choose your caregivers wisely if you have control over that choice. So that would be the first step, right?
Mm-hmm.
Choosing people who you know are being conscientious in this environment. You know, and that's the same challenge many of us are facing on both ends of the spectrum when we have caregivers in our home, is how much risk are we taking on, or how much risk are we mitigating by choosing who comes into our homes at this point, right? That's a daily problem I face with my patients, and I personally face as well. So I understand it on many levels. So I think you have to just, again, try to get to know the caregivers as best you can, develop relationships with them. And he may not have the wherewithal at this point, because I can't speak to the level of his disease process, but he may not have the wherewithal to be able to be his advocate. So if he does not, then I would empower you to be that advocate for him. So that would be my first thing, is to just try to be wise about who you choose, how you choose it. Now, if you say you technically have questions about people and you're really concerned, the safest thing to do is get an N95 mask, wear gloves, and wash hands before and after. And we believe that the N95 masks are the best protection at this point in time. Coming across an N95 and having an N95 for every single caregiver might be a bit of a challenge, but that's the technically correct answer if you're asking for the best protection, would be the mask and gloves and washing hands before and after. And then, you know, but really it comes down to just making sure those caregivers are limiting and them being transparent and honest, right? And I think the other, you know, making sure that they don't have a temperature, they don't have a cough, they don't have anything, you know, any symptoms when they come in. And absolutely, I don't think it would be too much to ask or inappropriate to ask every caregiver also to take their temperature before and after, you know, before coming into your home each morning, you know. And if they have a temperature, then you ask them, well, I'm sorry, you can't do this today, you know, but then that kind of puts you in a lurch, because then who is the caregiver for that day? But did that kind of answer your question and kind of help you in those areas?
Yeah, his facility is taking temperatures for everybody that comes in. They are not allowing people to go out. If they go out, they're very strict about them coming back in right now. And they've been doing that for probably the past 2 to 3 weeks, I guess. The problem is you never know if you're really carrying this virus. And by the time your temperature, you could have already exposed.
Absolutely, 100%. No question.
The talk I need to have is that I think to have full transparency and honesty with them is to reassure them that if they are not feeling well, we will still be paying them for a certain amount of time. Because I think that's the problem you find with some people, is as honest they can be. If they get sick, they're not getting paid. Just like I got laid off my job, you know, all of us are suffering with our jobs right now, is they're not going to get paid if they feel sick. I guess there's disability, but I think that's the transparency I need to have with them, is if you're not feeling ill, we will figure it out and we will try and help everybody. But that all answered my question, and it just made, I'm glad that he can hear it, because hearing it from me sometimes is not intense, but if I can say, Dad, a doctor said this.
Absolutely.
Thank you.
And, you know, feel free to go to my webpage and my Facebook page. We've tried to put some information up there on a variety of different things, and that might be a good resource for you to go to.
Okay, thank you.
Mm-hmm.
Great. I see some unmuted people. I think Carol, it looks like you unmuted. Did you have a question?
I was going to ask about, we have a therapist coming in, and for 1 week, the therapist had to stay home because her husband is compromised with his health, and she was afraid to expose herself to other people. So that means that we had to wait to get a new therapist to come in. And I wonder if maybe we could do this way, like telemedicine, do a televisit, and would that count as the physical therapy?
Whoa.
So there's a lot of research actually going on right now in the delivery of physical therapy services via telemedicine. A very close friend of mine is a pediatric physical therapist, and she was mandated to deliver all of her physical therapy services via telemedicine. So I don't know, I can't speak to the local areas, right? Because everybody is handling this so differently in each local individual area. But yes, absolutely. If you can find a provider to provide that service via telemed, then I think that's a good way to go. The challenge with physical therapy, from my perspective, both as a movement disorder neurologist and having been a physical therapist for so many years, there are so many components to PT where it is a hands-on approach.
Yes.
So there is definitely, I think that is one area that there will be missing pieces. However, the Big and Loud program, there are many online programs with that, right? So it's depending what your goals are. And I think in situations like this, it's setting expectations, right? And there are absolutely components of all of the therapy disciplines that can be delivered effectively in the tele setting, and I am a huge supporter of that. But again, it's adjusting our expectations to making sure the patient goals and the therapy goals are met in an appropriate format.
Thank you.
Mm-hmm.
Anyone else? Okay. I'm going to look at my chat here and see. Let's see, here's one that came in on chat. I have a telemed appointment with my movement specialist today. What kind of environment should I be in? And then we also had another comment also asking what to look for. How can a patient prepare for their telemed visit? So I think the environment would be part of that preparation for the visit.
So environment, I don't, as somebody who does this all the time, I really don't care, so to speak, where you physically are. What I like to do is have you sitting at a table or in a firm hardback chair during the visit. And then I would like a second person present if you aren't somebody who lives alone, because I want them to move the device that you're using for the televisit. Because I'm going to ask you to do this, I'm going to ask you to do this, I'm going to ask you to do this, right? All of those things. Then I'm going to say, okay, I want you to do the exact same things that you normally do, right? I don't know what I'm going to look like when I stand up, so I apologize if I look silly, but I'm going to have you do this and this, right? Those are things your doctor asks you to do. And I want to see what you're looking like when you do that. So it's hard to be the patient and the videographer for a movement disorder neurologist. So my tip would be that you have somebody else there doing that for you. It's really hard for me to see a rest tremor if somebody doesn't have another person there to video, to put I want the patient's hands in their laps and I want both of them resting. Well, that's a bit of a trick if there's not somebody else to video that. Sometimes I'll tell my patients, hey, I'll tell the person videoing, hey, move the camera down to their feet because I want to see those foot taps, right? Or I'll say, okay, they're walking now, put the camera more on their arms because I want to see that arm swing. Or I'll say, hey, can you put it down at their feet? Or I'll say, back up, I want to see their whole body a little more. So the expectations for kind of location are that, and having another person would be great. But if you don't have that, something is better than nothing. So I wouldn't cancel a telemed appointment because you didn't have somebody else there, by all means. And how should you prepare for the appointment? Just like you do any other visit. What I want to do is start to create an environment by telemed that's exactly like simulated like the doctor's office, and it's just comfortable for everybody, and you do exactly like you normally do. So you bring your list of questions, you have your medication list ready, you have all of the problems you've been having, all of those things ready to go, and the doctor's going to go through and I hope ask you all of the questions just like they normally would in the office.
That's a great to know. And also, for those of you who want to become a little bit more proficient on Zoom, if you're using Zoom, first of all, you can get a free account. So you need to go to the zoom.us website and get a free account. But there is also a feature on Zoom that may allow you to record your conversation. And that might be quite helpful if you're getting a lot of instructions, if you can go back and listen to that.
Yeah, so most of the telemed visits aren't
right.
going to be on something like Zoom. It's going to be through a telehealth application.
Okay.
And that might be the other thing I forgot about is, you know, my son actually had a telehealth visit yesterday. And here I am, somebody who does it, right? And I was at my interview with Serena, and I was like, okay, come on, Serena, we got to hurry up because I don't know how to get on my son's telehealth app, and I got to get him to his appointment. So we don't have one universal central telehealth app either. So that's going to be the challenge as well, is if you have 5 doctors, you may have 5 different apps. What most of the physicians are doing is they're emailing you a link. So that's what actually happened with my son yesterday is I got an email with a link to the telehealth application they were using. And so how you do that, and you know, I'm so glad this came up, Judy, because I didn't even think about this because this is just my day-to-day routine, but this is truly a logistical issue. So the email came in and I clicked on the link, and then you can see yourself on video, and it's as if you're in a waiting room. And even some of the telehealth apps will say that you're in the doctor's waiting room. It's kind of like a little gimmick thing they have. And you're just sitting there looking at yourself. And then when the doctor's ready, their face will pop up and you will see them. Mine is just a little bit different because everything is driven through my EMR, because originally I had this and I use an application that's very forward thinking. So mine comes through the electronic medical record and an email generated through the electronic medical record. And it's very simple and easy. My patients just click on it and they just have to have Google Chrome, and it's directly through my electronic medical record. But many physicians' electronic medical records weren't set up for this capability. So it's a separate application that you will be using. There's things called Teledoc, there's things called telehealth, there's all different branded apps out there. If you want to download the app, once you know the name that your doctor uses, you go to the app store like you would every time and you download that application. But that step isn't necessary. And I learned that actually yesterday with my own family, that my son needed to see his doctor and I was trying to download the app, but in reality, I didn't even have to download the app. I just had to go to my email.
Oh, well, that's good to know. Thank you for that.
Yeah.
I do have a question that's kind of come up about, you know, there are medications where you may have some sort of medication that is new. You want to prescribe new to your patient, maybe an inhaled medication or something, and you need to instruct them on how to use it. What do you think of that? Is there a way to do that with telemed, or is that a limitation? What's your opinion on that?
I chuckle because I think you're talking about Ambrosia. And I can say it, I don't care. And I chuckle because, again, to me, it's a non-issue. If I can do this with you, I can show you how to do it. And most of my patients who start Ambrosia, when I'm in their home live with them, I tell them, here, watch this video. And they watch the video. Well, I'm finishing up something on my computer, and when the video is over, I say, well, do you have questions? Do you want me to demonstrate it to you? And many times they say no, and I say, okay, well, here's a sample pack. Why don't you try the sample pack? Mm-hmm. So for my standard routine, that would be the only missing component. And how we're going to handle that now is we're just going to have those, when the patient receives the sample in the mail, then they can choose if they're comfortable to do a trial on their own or set up another video visit, so then I can be interacting live with them when they're trying it for the first time. So that will be handled on an individual basis, patient to patient. But that's a really good question. And again, it's just, once you start living like this, you don't really have as many hesitancies, I don't think. And not that we're going to do this forever, but using this method of communicating with the doctor and them interacting. And, you know, I got to tell you, I think some of the physicians are going to be uncomfortable with it. Some of my colleagues aren't going to like it.
Mhm.
And it does take some getting used to. It took me a while to get used to it. And I felt silly at first, you know, but it all comes in time.
It sure does. And there are, I think you're right. There are some physicians who just go, oh, that sounds, you know, just, it's just not something they want to do. And I think part of it is kind of, it's that they haven't done it, that they haven't had an experience of it. So,
Right. It's just like riding a bike, Judy.
right. And they still have discretion about the level of treatment and what they're comfortable with doing with telemed. Frankly, I'm hopeful. I think this is going to set a trend, and Medicare is going to have a hard time pulling this back after it gets going. And I think, you know, for people with movement disorders, it's just it's convenient, it's safe. They see their doctor more often. They can have those great conversations. And like you mentioned, they're not sitting out in a waiting room, you know, waiting for somebody else. They're in their homes where they're comfortable. And so I'm waiting for telemed to really take off and us get even more support electronically for doing it. So
Absolutely. Absolutely.
well, thank you so much. Does anybody else have any questions?
I do.
Okay.
This is Ken. I live, Dr. Boland, I live diagonally opposite you in the country. I'm in Southern Oregon.
Oh, yeah,
So
you do.
I don't think we could be geographically much further apart.
Right.
And one of the problems, I live way out in the boonies.
Yep.
And even when I go to town, which takes half an hour, there are no specialists. I mean, I've got a neurologist, you know, I've the general specialist, if that's not an oxymoron. But the only kind of specialized care I can get is up at OHSU.
Yep. Those are phenomenal guys. I know them up there, but yeah, it's probably too much work to get up there.
Well, yeah, I mean, it involves, I'd have to, you know, rent a motor home and, you know, it's an expedition.
Right.
The question is, are there, like in working with you, of course, geographical distance is not an issue.
Correct.
Unfortunately for me, finances are.
Right.
And being on Medicare, it's, you know, very good that most of my stuff is covered.
Right.
But you don't take Medicare at all, do you?
I do not. And I've chosen not to because even though we've lifted some of the telehealth restrictions, some of the things that I can do and not do limit my ability to freely practice. So you know, this happened so quickly. I can't say in the future if my team will make a different recommendation to me to start covering things. But one of the primary reasons why I chose not to take Medicare was because I wanted to provide these services like the telemed option. Now with the new mandates, I think it's too soon for my team who works with me to determine that. You know, you can go to my website and see my pricing. My telehealth pricing is pretty reasonable. When most people start doing the math of even gas, time spent, and their copays, it comes out pretty reasonable for most people. It sounds daunting at first, but once you start to do the math in that area, it's not as daunting as people think.
I've already looked at that.
Yeah.
And it's, no, it is somewhat reasonable. However, I'm just thinking of establishing a relationship with someone that far away. How far can that actually go? Because it's, I don't think you're going to be making house calls here. Although
no.
Where I live is gorgeous. Just don't tell anyone. I go 10 miles to the first stop sign and 15 miles to the first traffic light.
Yeah. So again, I don't feel that distance should be a limitation when it comes to telehealth, because whether I live next door to you or I live 3,000 miles away, we're still going to have that same relationship and dynamic because it's going to be on the computer. So I don't see that as, you know, the distance as a limiting factor, because you would still be interacting and working with myself and my team the same way you would be working if you were next door and chose the telehealth option.
Do you have any colleagues on the West Coast that are doing the same thing?
Not that we're aware of. We believe that I'm one of the only, prior to this whole shift, I was one of the only movement disorder neurologists who was the direct pay care model with telehealth included.
I would think so, yes. Thank you very much.
Yeah.
Dr. Boland, it sounds like you're taking new patients.
I am taking new patients, yes.
Okay. And I've heard, you know, you have a nice continuum of services because you, for supporting the care partners and the adult children too. And of course, now we have this great ability to go across state lines like Ken wants to do for telehealth.
Yeah.
So I want to make people aware not only that you are taking new patients, and I will show you all a link to Dr. Boland at the end of our conversation, and it'll also be on the recording, as well as a link to the article I showed you from about telehealth. But you know, PMD Alliance is also, we really feel like we want to get on top of telemed because it's just so good to be able to have the knowledge and offer good information to the people that we serve. So I'm sure as time goes on for all of you, if you keep up with us on our emails and on our website, we're going to be able to identify some of the physicians that are already listed as our partners and probably be adding new ones as well, where you can go right to our website and look at who might be available in your area for personal care, or also then telemed care, which opens up the entire country to you. So,
yeah, and you know, I just wanted to follow up on your comment about care partners and that kind of thing. So with how I have my practice set up is there's one person assigned with a text message number and one person assigned with an email. So if that person, the patient, is choosing to handle all their own affairs, then they would give me their email and their text message. But what I do a lot of times is the caregiver will have the text message or the email and the patient will have the opposite. And so that way both parties can easily and freely communicate with me. And, you know, when you text message, it's real time. You know, I always make the joke when I start off with my new patients, I say, if you haven't heard from me by the end of the business day, you're not bothering me, send me the same text message again, because I've probably gotten bogged down and I didn't see it, and it was a few text messages back. But, you know, I try to respond to those text messages each day. And then emails, I always say, you know, 48 to 72 hours to get back to you. So non-urgent things through the emails. But yes, absolutely. We try to include everybody in that. And I find that's where we really optimize quality of care, is when we get everybody involved. But that's not your whole entire network. That's you and one other person that you choose. So that's how my practice is set up, is there's two people involved, the patient and one other person.
oh, that's wonderful to know, because, you know, it is a team effort. And
Yes.
so having someone on your team who's also connected is great.
Right.
Okay, let's see. Are there any other comments or questions from anybody? I'm seeing, my clue is if somebody is kind of unmuted their video or their phone so they can speak, and I'm not seeing anyone, but if there is, please just speak up. Well, then it looks like we've concluded Lunch with Docs. I'm going to share my screen again for all of you so you can see these links, but I know that we will also have by, you know, probably tomorrow, by Friday at the latest, this Lunch with Docs sessions will be up on our YouTube channel, so you can get right in and look at it again, and also look at those web links again, you know, at the end of that we're doing right now. So Dr. Boland, thank you. Thank you.
You're welcome. It was my pleasure. I always love connecting with PMDA via tele, because that's how we normally do it now. I said to Sarah recently, she said, can we have a meeting? And I said, yes, when are you coming to Tampa? I wanted to go to lunch. And she said, no, I mean by computer. And I said, oh man.
Yeah, I think we're all going to be looking at screens a lot more lately. But we're really fortunate to have this. And I love being able to see all the faces because that's the closest I'm getting to everybody right now. So it's really nice. And thanks so much for all the good information you shared with us. What I'm going to do now is share my screen and.
Thanks. Bye.
Good. Oh, thank you so much. Goodbye.
Yeah.
And there you go. Let me get this out of the way. Can you all see my screen? Anybody saying yes?
Yes, we can see your screen, Judy.
Yeah, if you want to copy it, I'll just leave it up. The first one is the address for the fact sheet that I talked about earlier. The bottom one is Dr. Boland's practice. So you can go there, that's her website, and find out more about it. And, I think another benefit of telemed for those doctors who do embrace it is that way, even though you may move away from, wherever you were when you first started with them, they can stay with you. It's going to be able to allow doctors and their patients have a continuity of care that's probably going to be of huge benefit to many of us. So with that, I'm just going to leave this up for a while, but I want to conclude the meeting, and we'll just, we're finished for the day, and just wish everybody good health, stay well, stay strong, and keep moving. So thank you so much for joining us at PMD Alliance Lunch with Docs.
Thank you.